Welcome, my name is Marguerite Reinberger. What will the upcoming school year look like? The answer to this question will impact to various degrees students, teachers, administrators, staff, bus drivers, parents, businesses, and many other stakeholders, including all of you who are watching. As much as we would like to hear that 100% safety can be guaranteed, it is not realistic. It never has been for anything in our lives. There are way too many hard and in some cases impossible to control factors that just are going to play in to what the decisions are being made this year. My guests today include Melinda Lansfeld, the interim superintendent of Stillwater Area Public Schools, Dr. Jennifer Sherry, newly hired assistant superintendent of Stillwater Area Public Schools, and my longtime friend Lowell Johnson, director of Washington County Department of Public Health and Environment. And thank you all for coming. And I'll begin. Will you explain your background briefly so they know of where you speak?
Yes. So 5 days into the job here as assistant superintendent in Stillwater Public Schools. Very excited to be here. Have almost 20 years of experience in education and educational leadership. Was a high school business teacher, school district administrator, and spent many years in teacher professional development. Excited to be in Stillwater Public Schools. Very, very honored to be a pony.
That's sweet. What made you come here?
Well, I live right here in the River Valley. I have 3 students who attend public schools, have always wanted to be closer to home, and right here in Stillwater is the place to be.
Welcome.
Thank you.
Tell us about your background.
Okay, I'm Melinda Lansfeld, and just newly appointed as of, I think, July 2nd, the interim superintendent for Stillwater. I have been in Stillwater since 2007. Before I came to Stillwater, I taught kindergarten, 2nd grade, 3rd grade, 4th grade, gifted. I was an assistant principal back in Utah, and while in Stillwater, I've been a principal at Lily Lake Elementary, Anderson Elementary, Marine Elementary, Withrow Elementary. Yes, and I love our district, and I wouldn't have taken this position if I did not know the professionalism, the passion, and frankly the love that all of our staff have for our kids and our families. So we have a great group, and we're in this together.
Lowell, a little bit of your background.
Thank you. I'm Lowell Johnson. I'm the director of the Department of Public Health and Environment for Washington County. And I've been with the county 35 years. I just celebrated my 35th anniversary with the county, which is amazing. But I've had a variety of jobs there throughout my career, including the county emergency management director, doing emergency preparedness planning and work for the county, but then also worked in a variety of different health responsibilities within the department, including supervising and managing environmental health programs on like restaurant inspections and land use and water and septic and those kinds of things. And then moved into more policy development and administration. And I have been the director of the department now since 2005.
And I have served on several Washington County health-related commissions, and I'm glad you didn't retire or have any idea of an early retirement. Oh, my word.
Thank you. We'll see what this COVID is doing to me.
Yes, for sure. Even if you don't have specifics, can you tell us roughly even the statistics of COVID in Washington County with a focus on the prevalence of school-aged children?
Thank you. Some of the numbers just as of today, positive cases, we have now over 2,000 positive cases that we have recorded for our county. Unfortunately, there have been 44 deaths of county residents due to COVID. And
what ages?
Those are primarily in an older age category. I don't have the specifics of all those 44, right. But most of the deaths have been older individuals. But to your point, what we are seeing is gradually that median case age is going down, and younger people are being diagnosed with COVID-19. The current median age is about 36 years of age that we're seeing. And when you think about having cases of people in 80, 90, 100 years old, and then you work towards that median age group, you know that there's a lot of young people to get down to a median age of 36. And we have seen this trend happening since early May, that the cases are getting younger and younger, and so we're being very concerned and cautious about that. As related to school age individuals, we know that the prevalence is probably more towards the older teens in the school system. So we still aren't seeing a lot of cases in elementary school age children, that kind of thing. But we are starting to see more cases and have documented cases with, the 14 to 18-year-old students, that kind of thing. So
Are the
that's a
ones
concern.
low in that age group, the teens, older teens? What is the source? I mean, are they hanging out together, or is that what you're seeing?
Well, we know that for the overall population, community-acquired infection now, COVID is present here in our community. It's where you shop. It's where you go to your faith community. COVID is all around us. So we know that community-acquired infections are happening. But we are concerned about large group gatherings and activities where any number of people are in large group settings. And young people gravitate towards those things, and we do have to be cautious about that.
In comparison to other counties, how are we in standing with them?
The school district knows, and one of the criteria that we'll be using as we go forward to make decisions about back to school is what is called the 14-day case rate. And it's calculated on a per 10,000 population basis. And our per 10,000 14-day case rate right now is 15.6. And as I've looked at our neighboring counties in Minnesota, I don't have data for the Wisconsin counties, but Tuanoka or Ramsey or Dakota, we are below where they are, but we are all within that same, there's a grid that's been developed by the state of Minnesota, Department of Education and the Department of Health. And right now, our county and our surrounding counties are in that same kind of category on the grid of that 10 to 19 range for 14-day case rate.
How infectious are school-age children for, let's say their parents, for their grandparents?
Well, it's difficult to quantify how infectious, but I do think we need to be, everyone needs to be aware that COVID is transmitted easily. It's transmitted even asymptomatically, and that we all need to do our part to protect those most vulnerable individuals. And so whether it's children or young adults bringing COVID back to a home setting where you might have a multi-generational family, that's a big concern for us. Families that live in small quarters, small residences, apartment buildings, that kind of thing, that we're concerned about those types of family settings. And then all of us need to be just mindful that there are many people in our community that are vulnerable to infectious disease and people with underlying health conditions, and they might not be people that you would look at and say that person is, at risk, but they're all around us, and they're in our school systems, they're in our workplaces, and we have to all do our part to protect the most vulnerable in our community from this illness.
I assure you, Jennifer and Melinda, I haven't forgotten about you. I just want to lay the foundation so they can see why the concerns, why the preparation. Lowell, how did we go from a mostly long-term care concern in Minnesota to heavy community transmission?
Well, some of it is, as I mentioned, in a congregate living type situation where the person's living in that long-term care facility, for example, or a senior apartment building or an assisted living facility. They're there together every day, all day, and they're working with staff also in that setting, and they're always at risk for infectious disease. That setting is conducive to high risk of infectious disease. And then as we've started out testing early on, of course, we were only doing a very narrow scope of testing. And so we were finding where we were looking,
Were
which
you
we
even were you testing children at that age? You
not
probably weren't
most
even
children
thinking.
were not tested because they were not symptomatic. They weren't considered to be high risk, that kind of thing. So we were testing people in congregate living situations and healthcare workers, and then if you were symptomatic, you were able to get tested. And so, you know, some of that was a product of if you go looking for it in certain places, you'll find it there. But now, as we've been able to expand our testing and broaden our scope of view of where the infections are, we know that they're present in our community, and we've known that for a long time. But now we're seeing it more dramatically in all across many age groups. Yeah.
I'm going to view you as like a Dr. Michael Osterholm when I ask this question. Is it possible that COVID could mutate into a highly contagious measles-like virus?
I don't know that answer. To be very honest with you, I
to
don't
the point
know that.
where it's really, you know,
Yeah.
there'd be no
I would
school.
just say that, you know, influenza we know is a virus that mutates
Yes.
and changes. We got to remember we call coronavirus a novel virus because it's brand new.
Yes.
And we have to remember it is very brand new. And so we're just learning about this now. And really, we probably haven't even been through an entire season of understanding it. So we'll have to watch to see.
Now that the school districts are expected to respond based on the health of the community, you working pretty closely with them now.
We are, and we've already touched base. Our point of contact for our department, our epidemiologist, will be I'm sure on a speed dial for these guys.
Already on my cell phone.
Got it.
And we'll be working together very closely. In addition to our department, of course, the state is developing what they call regional support teams. So there will be professionals at the state level from both the Department of Education and the Department of Health, and then the local health department. And we'll be forming a team between the school district and the local health department and the state resources to really work on and respond to any concerns within the district.
Lowell, as I begin to ask questions of the district representatives, feel free to share insight, okay, you know, as I go through, because I don't want to exclude you. You're part and parcel of this addressing this major pandemic. So I'll start with Melinda. A one-size-fits-all school opening would have been easier, but not realistic given the varying degrees of the rates of coronavirus throughout the state. How will Stillwater Area Public Schools begin the school year? Will it be virtual, in-class, or a hybrid of the two? And key question, is that decision still evolving?
Hey, well, we just had a board meeting last night. The governor just came out with MDE, Minnesota Department of Education, last week with all of this information. We've been looking at there's a 5-step decision-making process. You are looking at the COVID rates per 10,000. Washington County, we've watched a trajectory going up. So I think on May 31st is the first set of data that we see that they're putting out. It might have been around 6 cases per 10,000, then it's up to 8, and then 10, 12, 14. Yesterday it was up to, was it 15? So it has not gone down since the end of May. We are between the 10 and 19 range right now, which according to the governor and MDE, that would have us starting elementary in person and secondary in a hybrid model. But then you keep going down the decision-making process. We have to look at our operational capacity. We have to take into consideration transportation and busing and the physical distancing. We can hold about a little over 23 students, depending on the size of the bus. We have to also look at staffing. We have staff that might have health conditions, or they might have family with health conditions. We need to look at our nutritional staff. Do we have enough subs? Do we have enough? We have plenty of cleaning supplies right now. A lot are on order for the school year. Do we have enough of those that will arrive in time? So there's a lot to take into consideration with the operational capacity. And at this time, just last night, we recommended starting all K through 12 in hybrid
Okay.
But we are going to continue to work with our health department, to work with our resource teams and evaluate the data and our operational capacity. So it might change depending on all of the decision-making process steps and our data before school starts.
And how many days would that include in person versus virtual?
Well, right now, we decided on an A, B, C model. So half of our students will be on an A model, going on Monday, Wednesday, in person. And then the B would go Tuesday, Thursday, and C would be a distance learning. So they will attend in person 2 days a week. 3 days a week would be online. Also, to offer our families flexibility, all families, and that's within the entire state of Minnesota, they have the option to do a full online distance learning program. And right now we are surveying families, and they have until August 9th to let us know what they would like to do. So basically 2 choices. They can opt for the full-time online. We're doing it at a quarter at a time at the elementary or a semester at the secondary, and then they can reevaluate their needs. Or we call it on the dial, where they need to have flexibility. It could go in and out of in-person, hybrid, or the distance learning.
Now you sum that up so well and so calmly, but it's just so intricate in what's involved in all.
Yes.
Wow. What, in fact, this is perfect for you, Dr. Newcomer. Dr. Sherry, what level of pressure are you feeling knowing you are the guardian and educators of our children during the day and have been entrusted with that duty?
Absolutely. So what we're really trying to consider is how do we mitigate the risk involved. And so with a hybrid schedule, starting out in that fashion K-12, we're able to provide much of the physical distancing that we know is so important, as well as providing some time in person with our staff and our students to focus on relationships and meet the social and emotional needs of our students. It's the physical safety, but it's also the emotional safety in order to engage our students in their educational experience. And so through a mix of the two, both in-person and distance learning, we're working really hard to provide an exceptional educational experience for our students.
Now, this is a question for all three of you, because as it comes in, it just seems so organized and really beautifully thought out, with obvious safety number one. But let's say, I know you're dealing with outside factors. Let's say you have one case, a child gets COVID. I mean, you can just see the parents go, oh, whoa, I got to pull out of this system, the three, whatever that child might be at. One case, I could just see disrupt. Am I wrong on that? I think parents are going to be ultra sensitive, no matter how careful you are.
I think we know that yes, there is ultra sensitivity. Our children are what we all care about the most. Whether it's your child or anyone else's, we all just, our heart breaks when a child is sick or a child is injured or anything to that effect. So it's a very emotional response when a child is involved in a medical situation or an illness, that kind of thing. So one of the things that the health department will do together with the school district is we will have plans prepared for communication. We're already anticipating a variety of scenarios and working through those. Some of that comes out in some of the state guidance. You should think about this, and there will be a letter that will go directly to the family of that child and others that have been in close contact, and then there's maybe a different letter that just informs the general school community, that kind of thing. But we're already anticipating and trying to prepare for the best, at least the most anticipated scenarios. Mm-hmm. There's always going to be something that's one-off, it's just a little bit unique, or something was involved in that particular situation that made it special and you had to do something different. But we are going to be planning and working together to prepare the necessary communications and guidelines and information. The other thing I would point out, and just people really need to remember this, that medical information about an individual is private.
I was thinking that too.
And
Right.
we have to be very careful and very respectful about naming names or disclosing information about an individual. And sometimes I hear that even from in a community setting, not a school setting, but there's someone in my neighborhood and I feel like I should know so that I can avoid or
Right.
not get, sick from that person,
Right.
that kind of thing. But we just all have to be very careful, and that's what the medical community and the health community and the school district are always very careful about, protecting privacy.
I know. I worry about a child being ostracized for life. Oh yeah, you're the one who had COVID. I mean, forever known as that, which is just tragic. As a child, to have that kind of stigma put so early on, like they caused the disruption of the school when in fact they were a victim of the COVID. Wow, so many more questions. Okay, so we have some idea of how the decisions are made. Who are the decision makers? And I mean, first of all, the lower level. Are we having parents involved, teachers, staff, bus drivers? Who's involved? And then at the end, is there like an upper level? Maybe 4 or 5 of you, Melinda, or you just sign off?
Yeah, we have multiple levels of support. We have our health facilitator, Paula McDonald. She's a nurse and has oversight. We are partnering with Lakeview Hospital. Just this morning we had pediatricians online doing a recording regarding coronavirus and what we can do to help staff. That's being recorded. We're also partnering with Washington County Health Department. We want these community connections. The more support we get, family means for the mental health and social emotional support. So we are having a lot of help that way. We have committees, our safety committees within our district. We are meeting. We're working on protocols. We've done a lot. We've put in hours and hours of preparation, but there's still a lot more to do. We've experienced cases of COVID during some of our summer programming on a smaller scale. So we've learned a lot from that on protocols and how to inform people, make sure that everybody's been communicated with, that needs to be communicated with, and gearing up for the school year.
Ultimate decision. Do you make it?
I'm going to make it with people, with data, with the science,
Okay.
and we're going to do it together.
Okay. Being in school, besides educational, offers a child a lot of other things. Can you go ahead and name some, because it's just not the education piece they're getting out of that setting.
Absolutely. So we all, as educators, want our kids back in school. We know that kids do best when they're face-to-face with an educator. A teacher is in front of them, helping guide their instruction. And also the social aspects around being with their peers and learning in a collaborative style with their peers. And so we all want our kids back in school full time at this point in time, knowing we need to learn how to live through this pandemic. We are doing everything in our power to try to find a suitable solution to make sure we balance that need and be able to provide a really great experience. Our kids thrive in those social relationships and the social aspect, and school is able to provide that.
In the nutritional aspect for some of them, they'll get meals that they may not be getting at home. That's major, of course. And I think, name some others, Lowell, that can you think, obviously the, exercise, the physical health that students get there.
Mm-hmm. No, you've named, I think, a good list there, along with Jennifer. The other thing I would point out is that we know for some children, school also provides a safe environment with trusted adult to tell about unsafe conditions that they may be experiencing outside of school. And so we know that school provides those resources for some children and some families as well. And so we have to be sure that we're not putting up too many barriers for the ability to help children in need or families in need when they have those circumstances as well. So,
Melinda, you would know this. What things went well or not so good during that last half of the year, and how has the district incorporated what they learned into the new school year?
Yeah, I think we learned the silver lining last spring. The teachers, other staff, it was a steep learning curve. We learned a lot about technology, about student engagement with distance learning.
Tell us some examples. 'Cause
Well, one of our communication tools, Seesaw at the elementary level, it's an interactive communication tool where we can share videos, we can share student work. It's kind of like a student portfolio. All of the teachers had to learn that. We had Google Meet and Zoom, what we would call asynchronous and synchronous learning, where it's live learning and we can record or flipped. So you can record a lesson, and then students don't need to watch it in live time. They can watch it at any time and have some flexibility. We learned about that. We learned about how important relationships are with teachers reaching out to students. Many of our teachers went to the homes and did the physical distancing just to make those connections. And we tried to cut it down to about 60% of a school day. We didn't want to overwhelm families. We were learning how to do this. Next year, we want to make it a lot more robust, more engaging, more synchronous learning or the live learning. And we want to offer a full day of learning. So
I know a lot of parents had great respect for the educators. They had some idea, wow, it's one thing they send them off and they come home and they see them in that setting, but to see them and how hard it can be in the classroom setting when the classroom is now taking place on a computer in their home. It was quite a rude awakening. I'm sure you had comments on that too.
yeah,
And you probably had parents comment that they weren't happy, the child wasn't interested, or I just can't even imagine the input that you would take from, or had to take.
yeah, and I do want to thank all of the parents that worked with us. They offered us a lot of grace through that time.
That's nice.
Yes,
That's
and
really nice.
and I want to thank them for that.
How is the district addressing social and racial inequality so that all students will have an equitable learning opportunity?
One thing that we're doing in Stillwater is we are going to be hiring a cultural liaison to serve the students and families and build that bridge between our students and our staff in working through supporting our students' cultural needs. And also, we are continuing along that trajectory of becoming more culturally competent as a school system and as a staff. So we are going to be partnering with a consultant moving forward and developing a think tank with our students and our community to understand how to meet the cultural needs of our students specifically, and how as a system we specifically address and interrupt any type of systemic racism that might be present in our policies and our practices in our school system.
And also I'd like to add with our learning, with the distance learning, our technology department, they've done a beautiful job getting hotspots out to all families so they have access and the opportunities for the distance learning, as well as devices. We've ordered, last spring, every family had at least one device.
Every family. That's great.
Every family, we made sure that they had at least one functioning, viable device. We've ordered more Chromebooks. We've ordered more devices because we now know if we go back into this in a hybrid or distance learning, I myself have 5 children. That one device is not going to work. So we've ordered more devices. And we also know that it's more equitable when students are in school. That's why we'll do everything we can to have students in person. We know that's best for them, but we also want to keep safety in mind.
I would just add, Margot, that this is critically important to address these equity issues and the social and cultural differences among students. We know that this disease is also hitting certain socio-demographic groups more so than others. And the people that suffer the worst and are having poorest outcomes from COVID are minority populations, low-income populations, persons that have had social determinants of health working against them for a long time. And so they've been transportation barriers, they've been economic barriers, cultural language barriers, a variety of things, housing issues. And those are the folks that are being hurt by COVID the most, not only across the nation, right here in our own community, in our own county. The disproportionate number of persons with COVID compared to the general population, we're seeing it here. So it's really important that we all think about those equity issues and try to address those.
Absolutely. How are you addressing students with special needs?
I'll take that.
Yeah, that's sure.
Yes, we have high priority student populations. That would be our EL students, our special ed students, our intervention
I like
students.
the word high priority.
Yes,
It
they
just-
are
yeah.
high priority. So we are working out plans. We want those students, some of them do have health conditions, so we want them in school as much as possible. We also want our little ones in school as much as possible. They're our most dependent learners. We are working out 4 days a week, possibly. We will collaborate with families. If they're special ed, they'll have an IEP. We'll be meeting together as IEP teams to individually see what they need so we can support them.
It just came to me on this. Do you have state required tests? Were they dismissed for the end of last year?
Yes, they were.
Are they back in play this year?
That is still in question. I
Okay.
have not heard yet. The state is looking, and our school district is looking into how do we better assess students during this learning environment? How do we grade students? How do we do report cards? So all of this is being worked on. It's just never been done before.
And it's unending, isn't it, Melinda? Okay. Wow. For the in-person learning days, what safety measures will be in play? Will masks for children, or what will be required?
We're looking into, we have hand sanitizing stations set up throughout the schools.
Required, or how some of them you go in now and
Well,
mostly-
we've put them out there. Every classroom, the cafeteria, all of the spaces will have the hand sanitizing stations. Our district has ordered a cloth mask for all of the students and adults. We've ordered the face visors for all of the adults. We've ordered disposable, I think it's probably around 15,000 disposable masks to start with. And then MDE and our state, they are providing all of the students and staff with the cloth masks. I think we have just under 30,000 disposable masks coming in from the state too. We'll need a truck to go pick everything up. Directional signs for physical distancing will be put in our hallways. We have cleaning supplies ordered for all of the teachers, little cleaning kits. We are going to be altering our HVAC system. Our outside air is going to be turned up. We will be cleaning filters, air filters, 4 times a year instead of 2 times, and all the preventative maintenance will be checked and rechecked. Buses will be marked, the seats, they'll have assigned seats, they'll all be spaced out, and we're still working on that. So this is the start.
Did the custodian position really become, truly, that's an essential worker when I think of all the things that need to be done after the students leave, after the staff and teachers leave for the school day. Incredible.
Yes, and I give them credit. They have been just doing a beautiful job keeping the buildings clean. They never stop. I have to give credit to our nutritional staff. They've served thousands and thousands of meals this summer to our families that need them. And our paraprofessionals, they've been there as well as our child care staff, supporting our Tier 1 essential workers that need that child care. So thank you.
I'll just add on to that in terms of providing that physical safety again. Thinking about our classrooms, and we're planning to have 50% of the students in the building at any given point in time. So reducing the number of students in the building, we're also able to reduce the number of students in any given classroom. So spacing out desks, providing that physical space in between students is something that we're preparing for.
Jennifer, who will be kind of overseeing that all of these terrific safety precautions are being adhered to?
Yeah, it's really a shared responsibility between us at the district level leadership, our principals, our teachers, our custodial staff, our health services staff. It's a team effort.
We have facilitators over every area with teams underneath. So district leadership start out, we have operations, we have food service, communication. Learning is at the heart and center of everything we do. That's the biggest area. And it goes on from there. And after they started planning, then we started bringing in teachers. We're bringing in other staff. We did a survey to parents this past spring. We did another thought exchange survey this summer. We're going to be bringing in more family and stakeholder input this fall.
Good. Melinda, how good is the response from parents?
It's a high response, and they want to be involved. They've been engaged, and it's really helped us to collect data on what their needs are. Just taking the spring survey results, that is allowing us to make changes and improvements as we go.
Lowell, any other precautions that they just may not have even mentioned that you know exists?
They've hit all the pertinent points. One of the things that the public health department will do together with the school is do some checks on those kinds of things. I mean, we'll be brought in, and they've already really articulated that they're doing a lot of the right things, but I know they're open and eager to have other eyes on those things and take input or guidance or suggestions.
Even though it means more work, which is,
then the daily experience will dictate some changes and some, as with anything, as we roll along here, I'm sure we're going to find a few things. It would be better if the placement of a certain thing was over here rather than here, because this is where the traffic flow happens, or those kinds of things. And that's where, together with the school district, the public health department, on our disease investigation end of things, we'll be looking at where did maybe some cross-contamination happen or something like that. And that'll be the advice.
Or where could it happen?
Yeah, or where it might happen and it could happen. So
remember, always that preventative mode you're always
exactly.
in. Yes.
We're trying to view it from that lens, what if kind of thing.
Routine fever checks is going to happen or not?
We are asking all families to check their children before they come in. We worry about the temperature checks with the crowds, with all of the students coming in, and then we've lost the physical distancing. We will have extra health staff at our schools if we do have any concerns with any symptoms coming up. I know also there's been some issues with the temperature checks. I myself was going into a building. They checked my temperature. I had just been in a hot car. It took at least four temperature reads before my temperature was down. And so that's hard when you're considering 500 students on average at an elementary school and thousands at the high school.
Playground time, will there be any?
Yes.
Good.
Zones. We are developing playground zones for the physical distancing.
What will that look like?
Well, we're still working on that.
Okay.
It's going to, the students will be spread out and fewer there.
Well, I mean, it's not like you have just your act together, I assume. I mean, just it's commendable. It's insurmountable to me, but necessary. How about lunch?
Lunch, we are working on that. Our little ones, if we can, kindergarten, first grade, we know they need that space. If we can physical distance appropriately in the cafeteria, we'll have them eat there. Otherwise, it will be a grab and go. We will have them eating in the classroom. And so they'll go in a class at a time, physically distanced. We still want to offer them choice because we want them eating food. We know that when their tummies are full, they learn and do better in school. And then we'll have them go back to the classroom. As we find out the staffing and the numbers and the amount of students that are opting to come back to school, if we have the space to spread them out, we'd love to have them in the cafeteria if we can pull it off.
What is the threshold or criteria for something happens inside? You get at least one case or more. that would say, wow, we're gonna have to put the brakes on this and go to all virtual. Is there a threshold or criteria?
Yes, the state has provided those numbers. I don't have them right in my
And
head
that would
right
be
now.
for inside?
Um,
Not just the community,
It's
Melinda?
for per building. They have
Got
some
it.
numbers
I got
on
it.
that, but
I
then
got
you
it.
have to look at, were they physical, distance 6 feet
Okay.
apart? Were they together longer than
Good.
15 minutes? You have to go down the protocol.
Yeah, are any of you sleeping anymore? Seriously, or dreaming about nightmares about this? You have anything to add?
I would
Lily?
just say that Melinda is exactly correct. There's a algorithm for
Yes.
just about every scenario, and but as we mentioned earlier, and then there's a variation within real life to that algorithm. And so it's the reason why we have to. It's a lived experience that we're going through, and all the time you would like to think that there's a laid out plan with A through Z, but there's Z plus A, and it comes up with a different answer.
Sure.
And so we have to really be thinking about all those things. But hats off to the district. You can hear they've done a tremendous amount of planning already.
Multi-level,
And
yes.
then it's going to be ongoing adjustments to that
Sure.
plan. But yeah.
Obviously, this costs. There's no free ride on this. Have there been any layoffs within the district of staff, or are there discussions on the table? I know you really need the staff.
Yeah,
Especially
I think
now.
we're more afraid of not having enough staff. We're going to have to hire extra staff, and then the state came out with a ballpark figure. Districts will most likely run most districts 1.8 million on average for the COVID costs.
I'm sure all of you are familiar with the pod concept, where you have certain students learn and they continue through the day, and there's no one's added into that group. Has that been discussed at all, or discussed and not needed, or what's the thought on that?
You want to take it?
Yeah, I'll take that. And
And will
so,
you explain it, because I'm sure I didn't do the definition as well as I would have wanted to.
absolutely, Margot. I think what you're talking about is a pod or a group of students who stay together for most of the day while they're at school, and there's not a lot of integration
Correct.
between groups throughout the day or throughout the week. And so we are looking at that in terms of our schedule and how we are grouping our students together. So working on a hybrid schedule, trying to provide as much time in the building for all of our students who are ready to come back. We will have up to 50% of the students in school on any given day. With that, at the elementary level, that's up to 15 students, possibly less, in a group in one classroom with their teacher throughout the day. At the middle school, what we're looking at is starting in a bubble. We're referring to this as a bubble. So students would be together in a classroom with an advisory teacher, receiving instruction from all of their curricular area teachers through an online format. So their teachers will be in the building with them delivering the instruction, but they'll have that one-on-one connection with a licensed teacher and together with their group of peers for the full day. So that bubble is like the pod that you were
Right.
just describing.
And I have heard the term bubble used too.
Yes, and then at the high school level, similar, but we know our high school students have some pretty intense curricular needs. We're just reducing the amount of transitions throughout the day. So transitioning from our typical 6-period day to a 3-period day, and blocking the courses, so they have a more intensive, more time together for each course, but fewer courses in a day. So students won't have as much transition between classes. And so yes, absolutely, at each one of our levels, we're looking at this idea of a bubble. Yeah.
Can you walk me through an elementary school day from home? They're at home, they're getting the virtual learning from there. Tell me what that looks like. What time do they have to be up? When do they finish?
Well, it's been very flexible. We're still It will be a full day. It'll be just like a school day with the curriculum. They will, teachers are going to try and provide morning meetings. They're going to try and build that classroom relationship. We will have our literacy blocks, our math blocks, science and social studies. We purposely asked our school board to delay the start of the school year by 1 week, and we're trading out professional development and grading days, putting them up front, because we want to give teachers a full 2 weeks of planning. They come back to school on a workshop week. This gives them a half a month to collaborate. We cannot have teachers working in silos anymore. We have to work together. Grade level and subject level alike will be collaborating to provide the instruction for our students.
I'm not sure if this is just anecdotal, but you hear of parents, oh, they're going to take their children out of the public school since they're home again, taking this in lax terms, they're home anyhow. We're going to put them with other students and hire a tutor to teach them at someone's home. Are you hearing this from parents? I don't know, threats or promises, or are you hearing that from other?
I think
parents?
everybody has to do what's best for their family. There's been many different options. One mother called me and said that they had opted for the online option, and they're renting a beach house in Florida for a couple of months to do their
Did you
their
say
classes.
you'd help them out, Melinda?
And so
January.
So they're doing their Stillwater schoolwork in Florida just to get away and
That's
enjoy some
something.
family time. So some of the families are adding some pizzazz to this and making it fun for their kids.
Anyone else want to add anything else so far that we've discussed? What are your thoughts that we unknowingly may be in the midst of a paradigm shift in terms of learning? Like this may be go on permanently, or that we will go virtual training permanently. Do you have any feel on that? Could you see it happen?
I think in education we have been for quite some time thinking about how technology changes the way we do our business as educators. And we learned a lot in the spring about the capacity that we had at the time to make that switch on a dime. Mm-hmm. We learned a lot about student engagement, and there are certain aspects where we're there technologically to deliver quality instruction, but at the same time, nothing surpasses that human connection that you have when you're face to face with another individual. And so I think that we are at a time where we are learning how to deliver quality instruction and educational experiences at a distance, mm-hmm. and we can do that well. At the same time, I don't think that we are at a place where distance learning replaces face-to-face instruction.
What will be done on things like proms? Are you thinking graduations, things people really felt they got screwed out of over the year? Has that been even addressed yet, Melinda?
No, and this past spring, I think we're just going to start having to think outside the box. This past spring, a lot of families got together and we saw some great videos of kids social distancing in parks and having a little prom from a distance. And so we're trying to make it fun. I know the high school team and the families up there for graduation, it was very difficult, but they put hours and hours and hours into planning and made it special for the kids. They provided a parade for all of the seniors. So there's a lot that we can do during these times.
And fall sports, for those who might not have been reading the paper or hearing about it on the news, what is going to be happening to fall sports, like football? I mean, a lot of sports, actually.
Yeah. Football is now going to be in March in Minnesota, so we'll see how that goes. They've shifted a lot of those sports to the spring. They have cut down, there will be no scrimmages. They've cut down the size of the groups. They are social distancing. So a lot has come out of that. They just came out with that a few days ago, and it should be out online. A lot of changes, but they do want to keep the kids involved in those activities. Those are important.
Do you
for our
see any
children.
sports going away?
No, I think we're going to have to modify, and we're going to have to change some of the dates, and we're going to have to see how this virus goes.
Shorten even the time frame on some of them for sure. So maybe. I'd hate to be a person who was involved in multiple sports and it's all like compacted, but very lucky to even be involved in that. That's great that they're still viable. What funding is needed, and where will that come from?
Yeah, we have some funding from the state. We have some funding from the federal government. We have some funding that we're going to have to tap into from our district, because we do have the extra cleaning supplies. We need the extra staffing, the busing when we're at a lower capacity. So this is going to come from a lot of different places.
Is it sustainable?
Can I just add
Yeah,
to
of
the
course.
funding piece? And so over the summer, we participated in a food program where all of our families in need could obtain meals, and anyone who needed a meal was provided that meal. As we move back into the school year, we're going to be reverting back to the funding requirements. So students who have an economic need will qualify for either free or reduced price lunches and breakfasts. But I will say that we need to continue to partner with our local organizations to meet the food shortages of our families. I see that as an increasing need that falls outside of the school district, but as a community we need to come together and make sure that our little ones are continually nourished.
Are you aware of any school districts in the state that are going to go a full-time school?
I believe Minnetonka just voted last night to do that.
Interesting. How about up north?
I haven't heard.
Yeah, I was up there this past week and it was like, wow, I didn't see anyone, let alone a child. I couldn't believe, how they couldn't socially distance even a block away and have them all. I mean, it was really, I thought about this and then versus our school district where you're doing the multi-level thinking and how it can change, and you're going to have to make adjustments, and you all know that. There's no surprise at that. Now, given that students are not going to be in school full-time, at least initially, do you fear that future school district levies are going to be much harder to pass?
I think we'll have to wait and see. I do think families care about their school, and we care about families, and this needs to be a partnership, and we need to collaborate and support each other through this time.
Is there anything else, and I want from all three of you, that you would like viewers to know about school safety as you open school that we have not addressed? And I'll start with you.
I think this goes back to what we learned in the spring. Families really had some insight about their teachers and how they lived. They were brought into the homes of their teachers. They saw the love and care that our educators have for our families' children. And at this time, we have really, I think, banded together as a community to meet the needs of our little ones. And we have appreciated the partnership and how our community is pulled together to celebrate the successes of our students. We're all working hard, and we need to do that together in a collaborative fashion to meet the needs of our students.
Weren't some of the teachers making phone calls to the students? Because I heard little kids really excited. Oh, wow, guess who called me? More excited than having Santa Claus call them. It felt like, but they were just thought that was really great. How are you doing? Just
Yes,
was wonderful.
not only the phone calls, but also the video calls.
Mhm.
And so that's what I mean. We were brought into
That's
the
great.
lives of our teachers. And I think understanding that our teachers are oftentimes parents themselves, trying to manage their job as an educator for all of their students, and also being a parent of a student as well, and managing all of those responsibilities it's a huge undertaking, and I think that our parents have really been appreciative of that, and our teachers also are really understanding of what a monumental task they have in trying to educate their students and carry on the task of being parents themselves.
Are there any resources online where people can see, okay, this is where we're at right now in the process, kind of an update?
What process?
Yeah, well, meaning, okay, we're going to, just exactly all the information you share, fantastic. I mean, you're doing so much. Is there anything online, any within even the district's website that talks about this?
Yes, there's an extensive information posted on the Stillwater Area Public Schools website. We would encourage all viewers, parents, and community members to go there for additional information.
Really good. Thanks, Jennifer. Melinda, anything that we haven't addressed?
I think Jennifer stated it well, and this past spring we did get to know our students quite well. I would sit in on some of the video morning meetings and got to meet a lot of pets and stuffed animals and shared books and stories, and they'd lose some teeth and a lot of smiles, but we do miss the kids. I truly believe the students miss that interaction. We want to get them back. I also want to, we've talked a lot about student safety and caring about our kids and keeping them safe. We also want to keep our staff safe.
Right.
Very important to us. That matters a lot too. And they're worried about coming back, but they want to do their very, very best for our children.
Does it seem positive that they'll be back? You know, I know there's some unions in different places that are saying, look, we're not coming back for whatever reason. From what you have seen, does it look
Yeah,
pretty
I think the
promising?
majority do want to come back.
Okay.
There are a lot of staff members that might have health conditions, or
Sure.
their family members might have health conditions, just like our students. And we want to try and support that too.
Sure. Lowell.
I would say we are a stronger, healthier community, entire community, when we have a strong school district.
Right.
And if you want to help kids get back to school and be in that classroom, we're wearing masks today to try to model the behavior and doing the right thing. Wear a mask. We don't have very many tools to address COVID. One of the few tools we have is that everybody can wear a mask. And if we do our part with that, we're increasing the chances that school can resume a more normal way at some point. And I would really say it's in all of our best interests to make school happen by doing our part to address COVID and reduce the risk and the spread of COVID in your community. And that is really upon all of us, whether you have a child in this district or not, whether you think you don't have a grandparent or a grandma who is at risk. But there are children that need to get back to school, and we need to tackle and address this COVID problem in our community. And one of the few tools we have is to wear a mask. Please do your part and slow the spread of COVID.
And as I started, I said, you know, there's nothing guaranteed on safety. You cannot promise it. You can mitigate risk, and that is probably the best you can do in multiple ways, as you've done. And I commend all of you. You definitely have the future of our communities in your hands, and I thank you for sharing your time and expertise and all you're doing that we have no idea. I mean, we just are glimpsing a little of it, so thank you.
Thank you, Margaret.
Thank you.
Thank you.